What happens when a government hearing stops sounding like policy and starts sounding like a cry for help? In this explosive confrontation, Congressman Steven Horsford brings Washington face to face with something far more powerful than political talking points. The real voices of families drowning under medical costs. A fragile child dependent on Medicaid. A husband and wife are crushed by a premium spike so severe that it pushes them out of everyday life. And across from him, the man tasked with protecting the nation's health. What follows is not just a clash of personalities. It is a collision between public pain and political power. And by the end of it, one question hangs over the room. When Americans are begging for answers, who is actually listening?
Thank you. I want to bring this conversation back to where I think it belongs, and that's with the people that we are all here to represent. Secretary Kennedy, while you're here, your boss is en route to my district in Las Vegas, trying to rebrand the One Big Beautiful Bill. But back home, my constituents aren't buying what President Trump is trying to sell, because they're living the real-life consequences of higher cost, less certainty, and real fear about losing their coverage and their access to care. During the majority's field hearing in Las Vegas last year, they shut out the public and brought in a paid actor. I took a different approach. I invited my constituents to share their real stories about what these healthcare cuts would actually mean for them. And what I heard wasn't a matter of politics, but rather of survival. One of those constituents is Deja, a mother of a medically complex child, Shay. Shay was born at 30 weeks. He spent 3 months in the NICU and came home on an oxygen and feeding tube, one he still depends on to survive today. He needs in-home nursing, specialist, and ongoing care, all made possible by Medicaid. Without it, his family would face inaccessible costs and copays, leaving Shay at risk of failing to thrive. I've also heard from another constituent, Richard, who told me that at the beginning of this year, his marketplace premiums went up $1,700 a month. He said he and his wife are effectively out of the economy. They don't go out. They don't get to go to restaurants. There's no discretionary spending because they're just trying to make sure that he has access to care. So families like Deja's and Richard's, to them, the healthcare affordability crisis is real and it's urgent. So let me bring it back to the basics, cost and coverage. What are you doing right now, Mr. Secretary, to lower premiums and to protect coverage for families like Deja's and Richard's?
Well, first of all, I would say, Congressman, there are no cuts to Medicaid. You look at the congressional...
What are you doing, Mr. Secretary? My question is, what are you doing right now? What are your priorities to reduce cost and ensure coverage for the American people?
Well, we negotiated the lowest drug prices in history. And we're implementing those now with the MFN. This is one of many things.
And how does that address coverage?
Well, in terms of insurance coverage, we're doing many, many things within the agency. We are, President Trump is right now with his...
What are you doing? You're the Secretary of Health and Human Services. Reclaiming my time. I'm asking about tangible actions and results. To me, the fact that you can't answer a basic question like bringing down cost and coverage, which should be your top priority, not some podcast, but actually addressing the needs of people. Now, like others, I want to make America healthy. I agree with the goal of moving from a sick care system to a true health care system focused on prevention. And prevention starts with the basics, clean air, clean water, and reducing exposures to toxins. So I'm struggling to reconcile the reports that some at EPA are working to roll back protections that would increase exposure to heavy metals in drinking water, arsenic, lead, mercury, and chromium. These are toxins linked to cancer, to heart disease, to stroke, and permanent brain damage in children. So just one question. Were you consulted on those efforts to roll back those EPA protections? Yes or no?
No, I haven't been, but I'm happy to talk to you right now about a long list of things that we're doing to roll back insurance premiums. And I would begin that with the skin substitutes. Our reform on that is reducing premiums in Medicare by 6% this year.
Have you aligned your goals dealing with the reforms to the EPA protections and how that is making people sicker, not healthier? That was my question.
Yeah, I could not answer those questions because it's
You
not
can't
in my,
answer the question as the
not my,
secretary.
it's not my agency.
You don't coordinate with the EPA, Mr. Secretary? Your department is not involved with rolling back protections that would increase exposure to heavy materials, even though it affects people's health? Is that what you're telling me? You don't coordinate?
I say, calm down, Congressman.
Don't tell me look, healthcare is personal
Okay.
to my constituents like Deja
Your
and
time
Richard.
is over.
Do not tell me to calm down. Healthcare is real. And if you can't answer basic questions, then maybe come prepared next time.
I'm answering the question. You don't give me the chance to answer. You haven't given me a chance to
You
answer.
said you
I'm happy
didn't-
to answer your
you said
question.
you
and
weren't-
you cut me off when I started to answer.
You said you
You started screaming
not
at
consult-
me.
Okay, the
with
time has
EPA.
expired. We're going to move on. Mr.
People
Yacob.
scream when they don't have much to say.
You obviously don't have anything to say because you can't even uphold what it is you're
Say it.
doing to
Mr.
reduce
Horsford,
cost
your
and
2 minutes
coverage.
over.
Give me a chance to answer the question.
By the time this exchange reaches its boiling point, it becomes clear that this was never just about one hearing, one congressman, or even one cabinet secretary. It was about the widening distance between people living in a crisis and the institutions claiming to manage it. Steven Horsford does not open with ideology. He opens with lives. A mother trying to keep her medically fragile son alive through Medicaid-supported care. A family watching their insurance premiums rise so dramatically that normal life itself begins to disappear. No dinners out, no breathing room, no sense of security. Just the constant fear that one illness, one policy shift, or one bureaucratic decision could push everything over the edge. That is the emotional engine of this moment, and it is why the room feels so charged from the very beginning. As the questioning continues, the heart of the conflict becomes more visible. Horsford is not asking for abstract philosophy. He is not asking for slogans, mission statements, or campaign language. He is asking a basic question that millions of Americans would recognize instantly. What are you doing right now to lower costs and protect coverage? It is a simple question, and precisely because it is simple, the inability to answer it cleanly becomes politically devastating. In moments like this, audiences don't just hear words. They measure confidence, empathy, urgency, and command. And when those things feel missing, trust starts to collapse in real time. That is what gives this clip its documentary power. You can actually feel the public's frustration moving through the room. Then the conversation expands beyond insurance and into public health itself. Horsford shifts to something even more fundamental. Prevention, clean air, clean water, reduced exposure to toxins, heavy metals in drinking water, cancer risks, brain damage in children. In documentary terms, this is where the scene deepens. Because now the argument is no longer only about whether care is affordable after people get sick. It becomes about whether the government is serious about preventing sickness in the first place. That shift matters. It broadens the story from a single family's survival to a national pattern of neglect. And it raises a much darker possibility. What if the system is failing not only in treatment, but in protection? And then comes the moment every viewer remembers, the line that turns a policy hearing into a viral political confrontation. Calm down, Congressman. On paper, it may sound like a minor remark, but inside the emotional logic of the scene, it lands like gasoline on a fire. Because to Horsford and to the constituents he represents, this is not theater. This is not a cable news sport. This is healthcare. This is survival. This is the unbearable insult of asking desperate people to stay polite while their realities are being dodged. When he fires back, do not tell me to calm down. The clip stops being merely informative and becomes symbolic. In that instant, he is not just speaking for himself. He is channeling every family that has sat on hold with an insurer, every parent who has feared losing coverage, every patient who has watched the cost of care outrun the ability to live. That is why this moment works so strongly for a YouTube documentary-style narration. It has structure, it has stakes, it has human stories, institutional tension, rising frustration, and a memorable emotional detonation at the end. But more importantly, it asks a question that goes far beyond party politics. When officials speak about health, are they speaking the language of the people who are actually suffering, or have they become so insulated by process, performance, and power that the crisis only becomes real when someone in the room refuses to stay quiet? And maybe that is the real reason this exchange hits so hard. Because beneath the shouting, beneath the interruptions, beneath the headlines, there is a truth viewers instantly recognize. People can tolerate bad news more easily than they can tolerate feeling ignored. They can survive disagreement more easily than indifference. And when a hearing meant to address public health leaves the public still asking the most basic questions, anger becomes inevitable. Not because the system is imperfect, but because the pain is real, and the answers still feel out of reach. So, as this moment ends, the bigger story begins. Was this just another heated exchange in Washington? Or was it a rare, unfiltered glimpse into the frustration building beneath America's healthcare crisis? That answer may depend on what happens after the cameras stop rolling. But one thing is certain. When families are fighting to survive, silence sounds like surrender. And vague answers sound like betrayal. If this clip tells us anything, it is that the battle over healthcare is no longer just about policy papers and press releases. It is about who is willing to face the pain directly and who still thinks the public can be told to calm down. And that is exactly why people will keep watching.